Dr. Alinsod, we're going to be hitting some really high-tech items. What are we going to cover today?
Well, today it's going to be pretty fun. The new plasmaphoration technologies that just arrived in the US. I'm going to tell you all about it. It's one of my focus. I'm going to tell you about low-level light lasers and how it can help feminine health, and also Femexa to plump up the majora, make it look beautiful, and then also cover the surgical aspects of my practice. I'm 100% labial surgeon, vaginoplasty surgeon, and I will teach you how to pick the right doctor. And for the doctors out there, how to get started and not get into trouble. That's what we're going to cover today.
Welcome to VNEW Health, powered by Arms Medical. We are unleashing the brilliance of Dr. Red Alinsod, combat gynecologist turned global pioneer in the areas of aesthetic vulvovaginal surgery. And so from preventing life-changing devices to training doctors worldwide, Dr. Alinsod gives women their second chance at confidence, comfort, and control. And this episode is brought to you by Stemmergen, all-natural stem cell supported system helping you heal faster and feel your best. So, Dr. Alinsod, we talked about the military and that transition point. What was it that inspired you to go from combat gynecology to pioneering aesthetic vaginal surgeon?
Well, it all started off from a disappointment. If you knew, I was actually going to be a gynecological oncologist and got accepted to a fellowship at Yale back in 1990. But remember the Gulf War, the first Gulf War? We're both military. Well, that kind of messed up my plans because the Uncle Sam said, "Hey, Red, you got to come in, serve now." And so I had to give up that fellowship I worked so hard for. And by the time I finished my Air Force career, I was just thinking, I actually love benign surgery, and I don't know if I want to take care of cancer patients my whole career. So I chose not to go and do my fellowship, and I focused my interest instead in benign surgery, pelvic reconstruction. You met me when I was doing that, meant 20 plus years ago. So I used that time to learn how to do a lot more pelvic reconstructive surgery. I had a great training. I was in a program that was almost like a fellowship level program, and I did all the suspensions, bladder repairs, and there was no augmentation at that time. It wasn't until I got out into private practice.
That was that. So I did not know that. Thank you for sharing it. That was a pivot from a fellowship. Welcome to wars that we have to deal with as a country. So thank you for serving and doing your call to duty. And of course, that led you to which I think you are having more impact now, and the things that you have done over the course of your last 20 years in gynecology, which is truly, truly unmet. And so congratulations for that. And you know, I sit there and say you're kind of winding down your career, but you're really not. Maybe your practice, maybe you're not seeing the patient load, but you're always inventing. What's going on? What's new? I got an opportunity to see you in Dallas, and it was great for us to reconnect in the operating room with the basics of anterior posterior repair with VNEW. But you're also doing a lot of new innovative stuff. Let's tell the audience what's happening.
I was in my California practice for just about 30 years or so, and then a couple of my kids decided to move to Dallas, and they said, "Dad, we're not coming back to California." So my wife said, "Nope, we're moving." So I sold the practice. Sold the practice, sold the house. Now we're in the Dallas-Fort Worth area, and I had a wonderful year and a half with my former fellow, Dr. Wesley Brady, and she helped me get transitioned into the Dallas-Fort Worth area. So first of all, I got to thank her for getting me comfortably into Dallas. And now I'm going to be opening up my Arlington practice closer to my home. I was driving an hour and a half one way, and it was just brutal for a year and a half. So now I'm going to drive 20 minutes and stay in Arlington and be right. My practice will be right below the airport and about 10 minutes, and it'll be convenient for my patients and
You
also
still have
parking.
you have a lot of patients that
Yeah.
have follow you from California, but then at the same time, you have a lot of patients that follow you and come to visit you from all over the world. What's the latest, greatest device that you're currently using, or some products that you're using?
Yeah.
I'm trying to peek under the hood and see what's going on.
Well, you know, my favorite surgeries are still pelvic reconstruction. You can't get me out of the OR. I love doing what we did 20 plus years ago, fixing bladders, fixing rectums, augmenting it with dermal allograft that Arms Medical makes. I just love that product. So I don't have as many patients because I'm a cash only practice, and a lot of the patients will go to an insurance provider. And so for me, that has been reduced somewhat because of the payment issues. But I still love it. I do as many as I can get because that's where I actually keep my skills up, and I love that type of surgery, and I know I can help the patient. And so I still have them flying in from everywhere for the surgery. But you asked me what's the newest things in my practice. I have two focuses in the past year and this year, and probably next year. My two focuses are the technology called plasma paration. It just got approved in the United States. It's been in Europe and some areas in Latin America. And plasma paration science is the use of direct current to open up the water channels in the skin. And so that these water channels now can accept any big molecule or small molecule, such as collagen. It can accept platelet rich plasma, exosomes, to help tissue regeneration or tissue engineering. So the water channels get opened, and these growth factors and signals to create new skin, thicker skin, more vibrant, flexible skin, and with increased blood flow happens. You are getting results similar to lasers or radio frequency without any disposables, and it's just a reproducible tried science in Europe, and it just got approved in the US in January. And so guess who gets to introduce it to the US? Yes, I've been traveling and speaking about it internationally too. I went to Peru, and I went to many countries such as Mexico and Guatemala, and spoke about this. So that's my most recent thing. But the thing
So
about
how
this
does it
device,
pause though, how does that device work? Because you said it's not a disposable. What does that what does it look like? You know, is it a machine?
it looks like a wand, like this, with a round circle at the tip. And if you know about Thermiva or some of the other companies with a radio frequency tip, it looks like a radio frequency device. So you're just treating the surface of the skin, and while it shrinks the skin, gives you a nice tighter face or a neck, but I use it mostly in the genital area, so I get a tightening of the majora and the vagina. But not only the tightening effects, the great thing about it is, again, it opens up the water channels. None of the other technologies open up water channels and allow PRP, exosomes, or other products to go deep into the skin to actually start the tissue engineering. So this works in two ways, similar to laser or RF in the tightening effects. And then in its own original and unique way, it opens up the water channels. It's a drug delivery system, FDA approved drug delivery system without needles.
So do you have that as a separate device? How, you know, are you injecting it? Are you using a cream? What are you doing as it opens up the channel now? How is it getting infused?
So what I do is I will put numbing cream on the surface. Let's say I do labiaplasties. My primary surgery are labiaplasties and vaginoplasties. I put the 30% numbing cream on the skin. I use this device, and I use it right on top of the numbing cream. And while the water channels open, the numbing cream goes deep inside. And so now the patient is numb on the outside, so that when I inject my local anesthetic, you have to still inject local anesthetic. When you inject it, they barely feel anything. They maybe a mild little pinprick or a slight burn, and then I can do my entire surgery pain free in the office, no IV, awake. The patient's watching a TV show or a movie or texting their friends during the whole surgery. It's really quite surreal almost, because you're doing these deep surgeries like a vaginoplasty or a posterior repair or a labiaplasty, and they're talking to you as if nothing's going on. It's quite remarkable.
So then at that point, so you'll do maybe a labia reduction. Is that part of your scenario that you'll do that? So it's which is no no anesthesia. You don't have to do a spinal. You walk into your office, which is beautiful, and they can have what I would consider to be a pretty it's a pretty complex surgery to have a labia reduction.
Yeah, it's a labiaplasty for sure are exceptionally complex, and you kind of have to think ahead many steps because every labia is different, and so it can't be cookie cutter. Everything is designer per patient, and so I'm able to do these surgeries, save the patients two, three, $5,000 because they don't have to go to the operating room. They don't have to go pay an anesthesiologist. Right there, I'm saving them money.
Anesthesiologist, surgical center, hospital center. I mean, that's right there. It's massive savings for your patients.
The case you saw me do just last week, that was that probably could have been done in the office, but because of anxiety and issues like that, we do it in the surgery center where you saw me. I could have saved the patient over 5 grand if she would have let me do it in the office, but anxiety issues, you got to do it in the surgery center.
Okay, very interesting. And then at that point, though, after you open up the water channels, now you are injecting your PRP. You've got some other hyaluronic acid. I know you also. I know the audience would love to hear about a couple of the other products that you have developed. Why don't you share with them some of the technology that you're using in your practice, which is very unique outside of most standard gynecology, urogynecology, or a urologist that's doing pelvic floor.
Well, you're right. Very few people do what I do 100% of the time. And my whole practice is labia vaginoplasty and like vulvar plumping and clitoral suspension, clitoropexy, even clitoral reductions for those who have had so much testosterone effects that they have massive looking clitorises. We also do the reduction of anal skin tags, and those are the most painful things around to do. And we're
Yes.
able, yeah, they're just
That is
awful.
that is
They're
what you will remember after the surgery. You can have your entire pelvic floor redone, and you'll remember the skin tag.
You'll
Also,
remember the skin tag, and we
the skin
figured it
tag
out.
or the hemorrhoidectomy, right? Reduction of your hemorrhoids. That is the part that you will remember. You'll be sitting down and remembering it.
It's actually awful until we figured it out how to numb it up. That plasma paration numbs up that whole area. I give the local anesthesia, and I use the light scalpel laser. It's the most brilliant CO2 laser. It's so precise. It's just like a tiny beam of light that's able to remove the skin tag very precisely and get hemostasis at the same time. It's a brilliant device, and we're the only ones in the Dallas Fort Worth area, actually, probably all of Texas, to have this device for precision anal skin tag removal. Not a lot of doctors buy it because it's like 85 grand, and so we have enough volume in business to take care of patients and pay for these expensive devices. But it's really truly remarkable. And also, I have a backup system, and it's sometimes my primary system of radio frequency, very precise pinpoint radio frequency tips that's able to take the smallest or the biggest anal skin tags also. It's the same device I use for labiaplasty, very precise labiaplasty, but we have the toys in our practice to accomplish my favorite surgeries, labial, vaginal, anal tag surgeries. People, most gynecologists and plastic surgeons run away from. We try to get them all.
Right. Well, I mean, we have a lot of physicians that watch this, and I would sit there and say, "Hey, if you're not doing it every day, every week, like Dr. Alinsod, send the patient to you. Dallas is it's a great move for you because now you've got East Coast, West Coast. American is the hub. You got 20 flights a day. You're right, going to be south of DFW, and they can come and have this done. And now with the technology of your new laser that you have, that they can do it in office and be pain free, which is a big hurdle because because now you've really reduced the overall expenditure for them to have this type of cosmetic surgery.
And it also makes it quite easy to fly in. You're right. You're exactly right. I chose this area because it's right in the middle of America. It's 2.5 hours to California, 2.5 hours to New York, 2.5 hours to Florida. It's very centrally located, and a million flights into Dallas Fort Worth. I mean, the weather's sometimes terrible, but the flights come in. And I take care of the patient. They can fly in the day before or the morning of. I do their procedure, and guess what? They fly home either the same day or the next day. It is really convenient, and that's one of the big reasons I chose to build my new office in Arlington, 10 minutes from the airport.
There you go. There you go. Well, we can thank your kids for that.
Yeah, this is my kids,
for,
Dylan and
for,
Samantha.
for getting you there. And then, of course, now you're taking advantage of it, which is fantastic, which in the end is just going to help more patients so that, a lot of patients in New York go, huh, do I want to fly to LA for the procedure? Now it's like you said, it's a short flight and it's so short, you're not even going to get a meal. All right. So it's under two and a half
That's right.
hours,
It's under 2.5 hours.
no meal service.
I have a couple other projects. My other big project, I told you I had two major projects. My other project I'm working on is low level light lasers. And low level light lasers, for those of for those of you who may not know, stimulates the electron transport chain so that it helps the cell and the functions of healing, anti-inflammation, and it can be used anywhere in the body, neck, for, let's say, pain, shoulder pain, back pain. And we've been using it a treatment before surgery because it helps the pain be reduced. And immediately after surgery, we use it. And I'm trying to find all these techniques to reduce the discomfort and to help with the healing. So low level light laser is my baby right now. And we're designing new devices with low level light lasers to help with things like dryness, atrophy, reduced sensitivity, all the things that I brought out and introduced to the market in 2015 with Thermiva. Remember, Thermiva was to thicken skin, help with moisture, help with the sensitivity and orgasmic response. And now that's a contact radio frequency. You have to put a device right on the vulva. You have to put it inside the vagina. And even with lasers, it's contact. You have to touch the tissues. So we're coming up with new therapies where it is using low level laser light without contact. Imagine how this would be for patients in nursing homes and places like this who can't get up. They keep getting UTIs, kidney infections. What if we can treat them without them having contact, nothing invasive, and then reduce the incidence of dryness, atrophy, pain, reduce their urine infections, reduce their kidney infections without contact, all comfortably. So that's my project number two.
If you can reduce that, then you can reduce their consumption in the pharmaceuticals, which, many times then create other issues because of the pharmaceuticals, and so that's, overall a lot better for the patient. What does that device look like? Is it a wand? Is it a paddle?
No, no, it's think of you getting a CT scan. You go, you lay, it's an arm, it's like this, so you lay under it. It goes, um various reasons. If you want to, for example, the same laser that can be used for the hair to help with the hair growth, you can put it over your head. You can put it, if the patient is here, you can put it in front, and it will shine light in the genital area. If you put it in the shoulder, the arm, or these things that go and shine the laser on the shoulder, you can reduce the pain, or the neck pain, C-spine. These type of lasers are huge in chiropractic office, and I don't know why gynecologists or primary care don't have it. They're just giving the market away to the chiropractors who are doing very well with this. So I think any primary care doctor who has an interest in pain tissue regeneration should potentially look at this, not just give it up.
I got one of your emails that you had sent out. You were talking about some hair restoration, and there's a lot of women that are perimenopausal or in menopause that have some hair loss? You know, how do you is this a device then that you'll use in that particular scenario?
It certainly can, and here's let me go back to that plasma paration. I'll tell you how brilliant it is. That plasma paration can open up the water channels in your scalp. And guess what? When you open up the water channels in the scalp, you can push in platelet-rich plasma, you can push in exosomes, and now most people are using exosomes because you don't have to draw blood or anything, it's off the shelf. And then you push it under the skin, and you can stimulate those dormant follicles or the ones that are fading away with time. You can stimulate them so that you have denser hair growth, thicker hair, and delay any hair loss. And then you can combine that therapy, the plasmaporation therapy, to open up the water channels. You can combine that with the low level light lasers that's anti-inflammatory to those hair shafts. So it's a brilliant connection. And I am actually a consultant for a company called Get Hair MD. They're the big guys in the market who are helping doctors set up. It's like a franchise program, hair treatment places, and they use this technology. I advise them to get a device to open up the water channel so you can push exosomes under it. They have their own laser system. They have their own laser hats. They have their own nutritional supplements. And a brilliant thing they did was DNA studies. They grab DNA swabs from your mouth and they send it to a lab, and the lab will tell you which medication works. For example, will minoxidil work? A lot of people, it doesn't work. So this DNA study will tell you if minoxidil, finasteride, and those topicals will work for you. So you're not wasting your money. So there's something actually scientific about it. So Get Hair MD is the company I consult with, and they're very brilliant at hair management and protecting your territory. For example, if you buy a Dallas territory, no one's going to be right next to you. Okay, they protect your area. If you buy a Beverly Hills area, someone else is going to have to buy a far city away, and they're not going to put a bunch of devices in the same area. So that company, I do love them because of their protection of doctors' investments.
Oh, which is fantastic. Any other devices, gadgets, products that I'm not asking you about?
Yeah, there's one a procedure called Femexa, Femxa. So you can go to femexa.com, and it's a procedure I developed where you use hyaluronic acid with PRP. Dr. Charles Reynolds actually invented that procedure, so I give credit to him. He used PRP with a little bit of HA, but I went a little bit more into the plumping cosmetic world so that I can put in more hyaluronic acid into plumping up a labia majora. So my Femexa procedure is how to plump up a very saggy and flat labia majora, and how to help conditions such as lichen sclerosis, where the thinnest skin and itchy. The same product can be injected under the skin and help these patients. So it's cosmetically more appealing, and functionally, there's less irritation. So for those of you who are interested, I have developed Femexa, the procedure, and the kit. I developed the kit. It's sold by a company called Juventix, Juventix, and it's called PRP plus HA. So platelet-rich plasma plus hyaluronic acid. It's in one kit, and it's so cheap for the doctors because if you buy this kit and buy individual components, for example, each one of these kits has 6 cc's of hyaluronic acid, like similar to Voluma, and that would cost you what, $2,500, $3,000 if you bought individual ones. And I was able to get sourcing to put this kit together at an affordable price. So each kit is on it's instead of $2,500, you can do this procedure with 6 cc's of hyaluronic acid for about $500 to $600. So it saves the doctor and the practice so much money. I can't see anyone buying individual Voluma 1 cc vials and spending all that money. You're going to go broke.
Yeah. Well, you can't it's hard to then you can't charge the patient, right? Because it's pain, and it makes it cost prohibitive. So, I'm gonna pause for a second because we deal with, ladies on this program. Let's go through a little bit of the anatomy because people might be familiar with the labia and think, that's just one body part. But, talk a little bit about the minora majora from a consumer standpoint. Walk us through that anatomy so the woman goes, "Oh, that's me," or, "Oh, yes, I know exactly what, Dr. Alinsod's talking about."
Well, you're right. I'm often quite amazed that my ladies don't know their anatomy, and many don't look down there, especially if you're in a region of a conservative region of the United States where they just don't look down there, right? So,
They
so
see this,
yeah,
and that's what they see. That's
yeah,
okay.
yeah.
That's okay. So let's walk them through so that though you can then talk about the condition because there's a lot of people that probably have this, don't know it can be fixed or repaired or enhanced. So walk us through.
If you are sitting on your bed and pretending you're getting your pap smear, getting examined by a doctor, or even pushing a baby out. Okay, some patients can relate to that. This is your opening of the vagina, right? Right here's the opening. The labia minora are the small lips that are right beside the opening, the smaller lips. That's the labia minora. They can be big, asymmetric, irregular, ruffled, and that's the labia minoroplasty, trimming the labia. Now, right beside those smaller lips is the labia majora. That's the fatty part right outside of the minora. So we call that labia majora. And that gets saggy and loose and wrinkled as you age. My average age of patients who want to have that fixed, whether it's plumping it up or trimming the excess skin, is about 45. So in their 40s is when it starts getting saggy. So I either plump it up if they don't want surgery, they just have lost volume and they just want it to look fuller. We use the Femexa on them. If they want it to be more petite and tighter and want a facelift for this area, it's like a facelift. I trim off excess skin on both sides. And then instead of them having very loose outside tissue, it brings it in and it looks like they're back in their 20s. So that's the majoroplasty. I do a lot of combination, minora, majoroplasty. And then on the very top, that little nubbin is the clitoris, and it's covered by a hood. If this is the clitoris, there's typically a hood over it. And sometimes this hood covers it completely and reduces the sensitivity for the patient. So I sometimes have to do pull back of the hood or reduce the excess folds on the side, and that's called a clitoral hood reduction. If the clitoris is hanging down so much, I may have to pull it up and suture it so that it's not sticking out. So that's called the clitoropexy. So we do all those type of surgeries: clitoropexy, clitoral hood reduction, and for those really big ones, we even do clitoral reductions. We actually reduce the actual size of the clitoris. We trim it back. We actually excise. We cut, and the nerves grow back, and it's the huge majority of time normal sensitivity. And those are the labial issues that we do: minora, majora, hood reduction, clitoropexies. Those are the majority. And I also have a very large practice for botched labiaplasties for those who didn't like the way their prior surgery turned out. And I revise a lot of them. I have patients flying from everywhere, just about every continent for revision surgery.
Unfortunately, it's still not, allowed in the mainstream, but, maybe Netflix someday, you'll be the botched in that world, like they have in California with with
Funny
with
you
the
mentioned Netflix. Funny you
Oh, yeah,
mentioned
you're
Netflix.
going somewhere. What are you doing?
Yeah.
What
Okay. So
television program you
mo-
going on?
most of your audience probably know what Netflix is, but most probably do not know that there is a website with gynecologic surgical videos, mostly cosmetic gynecology, called GynFlix, like Gynecology Flix, GynFlix. I started it about 5 years ago. And now I have doctors from over 40 countries who subscribe to GynFlix, GynFlix.com. It is my collection of 20 years worth of cosmetic gynecology and pelvic reconstruction videos. You know me, you've seen me record my videos over the past couple decades. We did a couple for you too. And it's on there. So during the pandemic, I had a lot of time because patients weren't showing up sometimes, right? So I started editing my 20-year collection of videos, and I started GynFlix, got them out there, and I couldn't train live anymore because doctors weren't traveling. So I put my training videos, original training videos, not the ones I used on my courses. Remember, I had 20 years of courses. I had many videos outside of that, not part of the course, that I edited: labiaplasty, vaginoplasty, hood reduction, anal skin tags, Thermiva, laser treatments, Femexa, everything I do in my office, everything that I've collected. I edited them, I put them on there, and we started GynFlix. And it's probably the best way to learn without having to travel. You can learn all this stuff in your bedroom or in your office.
And I know that people will take it, right to the operating room. Put it on an iPad because you give step by step for the surgeon that, maybe has taken the course, wants a refresher, wants to just check out, where did he start on this particular patient? What I start the incision. I mean, you have it down to where you can really dial in if you're a new surgeon going into this cosmetic program.
I created a special section and I call it um, cheat sheet, the cheat sheet, all my top short videos. I put it all in there exactly for what you mentioned, for the doctors to review before they do surgery. So instead of looking everywhere on my website, because I have hundreds of videos, they just go to a section called cheat sheet, and I organized it: labia minoroplasty, hood, unified approach, perineoplasty, vaginoplasty, Thermiva, whatever. I lined them up so that you can go watch it before you do a case and get a refresher course. And then I created another section for patients, and I called that section shorts, because I took my 1, 2, 3 hour videos, compressed them into anywhere from 3 to 5 minutes for the patient to get an understanding of what these procedures are, so that I can educate the patient and also educate the doctor on how to do the surgery. So those are there. So if there's anyone interested in cosmetic gynecology, go to gynflix.com. It'll blow you away. It's amazing. I have a couple of subscription tiers. You can do it very cheaply. It's like $98 a month. You can't get any cheaper than that for my 20 years of content.
You cannot. And one of the things that's, you know, I don't know how many people know this. I do, just because I've been to your office. Uh, if you ever decided to leave gynecology, well, you could be a professional photographer. So, that's, I guess, part of the ability to really showcase these not only the videos, but the images that you have collected over the years, before, after, before, after, before, after, and and that's really a testament to the fact that you're so passionate about just outdoor photography.
I actually teach gynecologic photography. I think I'm the only one in the world that started teaching how to take pictures of before and afters of labia, vaginoplasties, things like that. So when I was having my live courses, I taught the patients, I brought models in, and I taught the very nervous and anxious doctor how to relax, how to talk to the patient, how to do their consents, and how to do gynecologic photography, because it's tough. If you've never done it before, it's one, embarrassing. It's tough. You don't know what you're doing, really. You don't know the lighting involved. And so over the years, I recorded all that, and I have it on GynFlix now, so that a doctor can learn how to do gynecologic photography, gynecologic videography. It's not easy. It's not easy.
No, no, and you have, you've taken all of the uh, nuances and put them in a way that they'll be able to understand, and then, with the goal of getting close to what you are able to produce, so that they can also start their collection as they, if they're just coming out of fellowship and this is something that they're passionate about. One of the things that I do know is that people can come see you, they can shadow you. You have programs that allow that. So to talk about a little bit of like, how are they, what does that look like? What will be in store for if they spend a week, couple of days, what do you usually line up for them?
Well, it's a couple different tracks. I started my teaching career teaching pelvic reconstruction with biologics or mesh. As you know, I was one of the guys at Caldera Medical, one of your former jobs, and I helped design a sling for them, and I actually helped design a biologic mesh and a nylon mesh. But over the years, with the FDA and all the issues with the lawsuits and stuff, this company just now makes a sling, and you're the company that makes the beautiful dermal product. And for those who want to learn that, I teach the pelvic reconstruction. Doctors call me, and then we'll spend a day doing surgery and teaching you how to do anterior repairs with mesh or um, uh, without polypropylene. And because I don't teach polypropylene anymore, I only teach use of dermal allograft, your dermal allograft. It's the best one in the world. And so I can teach for that. In terms of cosmetic gynecology, I taught 20 years in Laguna Beach, one on one or a small group of two doctors, and I would spend 4 days doing surgical and non-surgical work, labiaplasty, vaginoplasty. That's now online, and my teaching program, I actually when I left California, I sold my practice to a doctor, and she has my teaching program too. So I don't teach live courses anymore for the cosmetics. I have many of my outstanding fellows around the world. Dr. Alex Bader in the UK, he's the most renowned cosmetic gynecologist in that part of the world. Dr. Amir Seyfeldin in Cairo, Egypt. He teaches in all around the world, including Dubai. Dr. Rafal Kuzlik, probably the finest surgeon in all of Eastern Europe, has a course. Dr. Sejal Asmera in India has the most renowned courses. She's very well known. So all my fellows now have taken over my hands-on training. In the future, I may do small courses again. But boy, these guys are sharp. They have good hands. They use my GynFlix as their continuing medical education. But I have to hand it to them. Doing it for 20 years was long enough. I may do a few more in the future. Who knows? But right now, it's all my fellows that are doing the hands-on teaching.
Every once in a while, they get the rock band to come back out again, right?
Yeah, once in a while we'll do a rock concert, right?
There you go. There you go. Anything else that you'd like to share with our audience before we wrap things up?
Well, for two things really quickly for the doctors who want to enter this field, I think you can't just pick it up and start doing cases without training. You're going to get sued. I do a lot of medical malpractice work, and it's almost always a doctor who had never taken a course, who had never actually gone to a congress. I look at their CV and stuff, and it's hard to defend them when they show no training. And this goes for plastic surgeons also. Plastic surgeons are perhaps worse than the gynecologists because the plastic surgeons are trained in cosmetics, and they just think they know the intricacies of labial surgery. It's not easy. And I think gynecologists, plastic surgeons, cosmetic surgeons, anyone who does this needs to be trained. And if you're not getting trained and you're just picking it up, going to the OR, you had watched a couple of videos, you read Dr. Alter's article or Dr. Goodman's article, and then start doing cases without actual hands-on, you're going to get sued and you're going to be in trouble. That's for the doctor, okay? So get trained. Don't do a shortcut. Go get trained. Uh, and for the patients, uh, be careful who you pick. Make sure they're actually trained. Okay. If here's a hint for the patients. If your surgeon that you're researching does not have an extensive before and after photo set, then they haven't done enough. If they give you the excuse that, oh, that's for patient privacy, blah, 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 that's why we don't take pictures, that's because they don't know how to take pictures. They don't do enough cases, and they don't know how to talk to the patient to be comfortable enough to allow them to do these kind of cases. Okay. So I think that's a really important thing for the patient out there. Do your research, look at the before and afters of your proposed doctor, and be very skeptical if they don't show any of their work. Be very skeptical.
Yeah. And if you're, you know, a woman that's watching this program right now, you can always send us a note to info at Arms Medical. So you can say what you're trying to accomplish from a surgical standpoint. And Dr. Alinsod and myself, we know a lot of people from around the country. And if you're in a particular area, we can always at least recommend, hey, let's start here for this particular procedure. Then, of course, you can get a second and third, but at least you go in to these type of conversations with your physician with that knowledge in the background, and you watch a program like this, you can see what they should be doing.
I think that's very smart. Do your research, go to the one with the best hands, the one that you feel comfortable with, someone who's not so flippant that they'll just brush you off, someone who can actually talk to you. So be careful of who you choose.
There you go. So, Dr. Outside, always a pleasure. Thanks for having me in your OR last week. I appreciate it. And of course, you're always giving women a second chance with all the procedures that you continue to advance and involve. And to our listeners, of course, if you like what you see, we always want you to hit the like button, subscribe, and share VNEW Health with other people that you think want to be empowered like you. So thanks for having us on the program, and we hope to have you back in the near future.
Thanks, Rob. I appreciate the opportunity for our yearly update on cosmetic gynecology. Thank you very much.
You're welcome.